Hello everyone, I am Dr. Ameet Oswal, Consultant Interventional Cardiologist, Bangalore. Today we will discuss on a topic pacemaker. So what is a pacemaker? It is a device which is placed under the collarbone on either the side with the wires inside the heart, and the purpose to use the pacemaker is to control the heart rate. So either it can be a low heart rate or the fast heart rate for which the pacemaker will be used. How is the procedure done? The procedure is done under local anesthesia or rarely under a conscious sedation. So first we make an incision, we create a pocket to place the device, which will be of a size around 1.5 inches into 1 inch into 5 to 6 millimeter in the thickness, and we attach it to the two wires which are placed inside the heart and screwed it, and then we make a suture and close the area. The total duration of procedure is around 2 hours maximum, and it can vary depending on the type of pacemaker procedure is undergone. And here if you see, this is the place, this is the vein we select from this side where the wires are inserted, and we screw the wire in this chamber, that is right atrium, and another wire in this chamber, which is right ventricle. So what are the indications of the pacemaker? The indication of the pacemakers are: 1. Complete heart block, where the heartbeat is very slow, less than 40. Second, it may be because of the heart failure. Third, it can be in the patients who has recurrent ventricular tachycardia to prevent sudden cardiac death. So what are the types of pacemaker? So 1, it can be a dual chamber pacemaker, it can be an implantable cardioverter defibrillator, or it can be a cardiac resynchronization therapy, also known as CRT. Benefits of the pacemaker procedure: 1, the heartbeat, which was always on a lower end, will be normalized. So the symptoms which we are facing because of the low heart rate, like tiredness, syncope, or we call it fainting episodes, or giddiness, those will be aborted completely. Second, if you are having recurrent heart failure episodes, that will be reduced once the CRT procedure is done, which is a specialized pacemaker. And third, if you are having a recurrent ventricular tachycardia wherein the doctors has to use recurrent shocks or they have to give a cardiac massage, that can be prevented by putting an ICD machine. So what are the complications associated with pacemaker? So any procedure definitely carries a risk. Even pacemaker has a risk of complications, like when we are doing a puncture here, there are chances that there is air leak out happening around the lungs, which is called as pneumothorax. Sometimes there can be bleeding, sometimes there can be arrhythmias, but these are all complications are very rare when the procedure is done by an experienced cardiologist. Then what are the post procedure care needs to be taken? 1, once the procedure is done on the left side, you have to make sure that particular side of the pacemaker, the hand has to be immobilized for 2 weeks. Immobilization in the sense it should not be lifted above the shoulder. It can be moved until the 90 degrees, and you can move the hands, you can do all the movements, but not beyond the shoulder height. Second, you have to make sure you don't come across any strong magnetic fields like security system which are placed in the airports or the malls. You are not supposed to enter through that, because the pacemaker which has been placed can malfunction suddenly. Second, you cannot go near the transformers which can again have a strong electric magnetic forces. You can definitely use mobile phones, you can use household appliances, no issues, but be careful with the microwaves, be careful with the ovens, so wherein you don't come in too much contact. That is the most you can do, and you can start doing your routine activities from the next day post procedure. There are no other problems associated with the pacemaker. If you have any more queries, please log on to drameetoswal.com website, or on a social media you can search for Dr. Ameet Oswal and find more information. Thank you.